Thanks for joining us for another edition of To My Way of Thinking. I'm Fred Matthews, where we talk with the tree shakers and policymakers and those persons who are trying to make a difference in our community, state, and nation. Today, we're going to have a conversation with Dr. Tanya LeBlanc. She has many titles. She's a senior health scientist and epidemiologist for a national public health agency. She has worked on COVID-19 protocols that have helped, hopefully, have helped me and others all across the country. I know it's helped me because I got all my shots. She's an associate editor of American Journal of Public Health. She's been that, at least, or is that, yet still going on. And she's acting deputy science director at the same National Public Health Agency. Tanya, welcome to My Way of Thinking.
Oh, thank you so much, Fred, for inviting me to your wonderful podcast. And I really like to go by Tanya Telfair LeBlanc because I like to keep my maiden name in there so people will know who I am. But thank you so much for inviting me. This is a wonderful podcast, and I'm hoping your audience will increase as you go forward.
Yes, me too. Full disclosure, Dr. Telfair and I have known each other for a number of years that date back all the way back. And it's just a pleasure to have watched her career blossom and move to the state in which it is right now. I'm going to talk about some of those early years in just a few minutes, but let's get to where we are. We are at the time in which we're recording this. There are a number of issues, health issues, that are facing our country, and particularly here in the South, in the Cotton Belt, Southern Belt. There's still a number of people who are resisting the advice given by you as health professionals and the government, quote unquote. But nonetheless, we've been able to weather our way through a lot of the pandemic that has faced us as we now are in year 3. What is the state of public health as you see it today?
Well, the state of public health is it needs assistance at this point. In the last couple of years, you can vividly see through the COVID-19 response that we have some real concerns with emergency preparedness in particular. And I wanted to just talk a little bit about what emergency preparedness actually is and how that relates to not only public health, but in society itself. Public health emergency preparedness really is a conglomeration of activities that we have to take as a nation to prepare for natural or man-made challenges that may come up, disasters that may come up. But the goal is to reduce harm and, of course, reduce property damage, but more importantly, harm to individuals. But what does that really mean when you think about it? Because millions of dollars have been poured into preparedness activities, and it involves a lot of state, federal, and local actors, as well as community actors. But not all communities get the important information that they need. And that's something that I've been really aware of and cognizant of. The building blocks of preparedness really rest in the organization of society itself. When you have a society that has a lot of homeless people, that has a lot of poor people, that has a lot of people who don't have access to health care or have access to limited health care, how can you prepare when the building blocks are not there to begin with? So that is my focus in terms of dealing with emergency preparedness. I try to be a voice of reason and to help the policymakers understand that it's not just a list of activities. It's people in communities, and there are lots of people in communities that are not necessarily getting all the things that they need, to survive under normal conditions. And so how can you expect them to be protected under strained conditions? So to me, some of the threats to preparedness include the way our country is sort of so divisive. You know, if to really prepare for an emergency and get everybody on the same page, we have to think of ourselves as a people and be willing to help each other. But as you can see from COVID-19, even mask wearing, getting vaccines, all that, all those public health interventions were politicized. And so you still have people who are not willing to wear a mask in public to help themselves or others, not willing to get vaccinated to help themselves or others. And so one of the critical building blocks of preparedness is really being united as one people, willing to help each other. And then another thing that's really interesting and that really came out during the COVID-19 response is that the public health agencies need to work together. We saw a lot of information coming out from this place and that place. And so people were confused. And so agencies working together and having one voice and not giving confusing information to the public is really important. And then going down to the communication channels, you know, people are confused. So you have to have, you know, credibility in terms of communication. So I think those are some of the things that resonated with me as I served on the response, understanding that, you know, factual, believable communication must be conveyed to the public. And in the current media situation, it's really difficult for people to know what to believe.
Well, are you finding that, and this is an obvious question, but I would presume that you and the agency that you associate with are sending out fairly consistent information about public health, and obviously about with the pandemic that we've been faced with. Currently, there's the argument about to wear a mask or not to wear a mask, and that of course goes along with you know, your health, your age, and what your particular state or city is deciding to do. So are you seeing consistency in the messaging?
Well, see, that's the problem. We give out consistent messaging, but the way that message is conveyed in our segmented media markets really makes the difference in what people actually hear. And you can see from this court case that liberated transportation venues from masks. You know, just recently, that one judge that made that recommendation really was internalized by the transportation industry, and so masks have been abandoned largely. So it's just what I was talking about before, how complicated everything is in this country, and how the communication channels that bring the information to individuals sometimes can distort the messages that really come down from the science. And so that's a big problem in this country. In fact, I wanted to talk about that a little later, but I guess I'll introduce it now since you brought the problem up. One of the biggest problems in our country is misinformation and disinformation in our segmented media markets. By that, I mean the different channels, either online or on television or in other avenues, are segmented based on people's biases. And you have some channels like Fox, and I will bring Fox up, and OAN, and some of the other ones that really don't give people accurate information. They spin the information in a direction that is politically lined up with their biases and what their audiences want to hear and receive. And so it's very difficult to get the truth out to individuals. We're seeing what's going on in the Ukraine and what's going on in Russia. Russia has a propaganda machine that is state-run. But here in the United States, we have a propaganda machine, but it's not state-run, but it is run by the segmented media markets. We have media markets that prescribe to a certain audience, and they convey messages that line up with their biases and mythologies. And so it's really hard to get truth out there. I mean, unbiased truth to individuals living in communities.
Well, what is the truth? What is the truth? If you're telling me that
Mhm.
that Omicron, whatever number we're sticking on it these days, and the
Mhm.
Delta before
Mhm.
that, and the one virus before that are all serious to me. And
Mhm.
I've got someone that tells me that I could take some horse medicine, Invectin, let's take that for one, that will actually get me through a few days of it or get me through the worst of it.
Mhm.
I mean, and you know, I heard that it worked. Somebody took it and it worked for me. Why wouldn't I? Why wouldn't I go with what my friend says instead of taking this from some alien person in the government uh, that tells me no, get the shot?
Right, that ivermectin you're talking about, that some kind of a veterinarian cure that has been sort of appropriated and put out on social media channels and by word of mouth, that it can help with COVID. Um, though you take a risk by accepting that kind of information, because there are no clinical trials that prove the effectiveness of ivermectin. And so, in fact, what I've heard and what I've read is that there are more harmful effects associated with that kind of substance taken into the human body. And so this is the problem that we have. We have social media and in pockets of social media chat groups and interest groups that are sorted by biases and interests. The algorithms on social media will sort you into groups that they think are like-minded with you. And sometimes in those groups, you have a lot of spurious and questionable information spread. And that is one of our biggest problems, as I just said. How do we prevent people from taking up dangerous practices that are not grounded in science, and risking their lives or the lives of their families
Well,
by
should I be taking the shot, or should I take some of the preventative things that have apparently been approved that'll keep, if I have symptoms of COVID, should I just go ahead and get some of the preventative things that apparently have reached some FDA approval, or should I just get the shot and not worry about taking these preventative measures that are out there? And
as
putting
long.
aside the ivermectin,
Mhm.
non-confirmed one, but there are some medicines,
Right.
some medications that have been apparently are there to take care of symptoms
Mhm.
in lieu of getting the shot.
Well, I would say you have to judge how old you are and where you are in life and how vulnerable you are, what kind of different chronic diseases or issues that you have in your body that put you at an increased risk for poor outcomes if you contract COVID, and then make an informed decision for yourself. I would do as much as possible to prevent contracting COVID as I have done. I definitely wore masks, and I'm continuing to wear masks when I leave my house. I also don't congregate for the last couple of years. I've been almost a hermit. I don't go very many places because I don't want to contract COVID. I also got the vaccines last year, the Moderna vaccines, and I will continue to do what I can, on my end, just as an individual. But that's an individual decision. If you would like to take some of the FDA approved prevention remedies, please, I don't see any problem with that as long as it's FDA approved. But some of this strange, wacko um, preparations or whatever that people share on social media, I would stay away from those. It's entirely too risky. So I wouldn't anything that if you find it someplace on a spurious social media site, I would not definitely not take something potentially harmful into my body. And then as you are judging what you see on social media, one of the things I always tell people is look at the sources of the sites that you visit and the sites from which you get information. Look and see who's funding that, and look and see if they're trying to sell you a product. There are a lot of questionable social media posts out there that are designed to drive you into giving them money or paying for some product or some service that they have. So, as you discern information that you receive, make sure you know who's funding it, what the source is, and if the source is credible. I think that's one of the messages that I would love to put out there with people. Check and see and fact check information that you receive on social media and other sources. Make sure that you're not going into one of the rabbit holes that really is designed to pick your pockets. And that's what a lot of information on social media is designed to do. They will get you all stirred up. They're designed to be provocateurs and anger people, pushing their buttons, their emotional buttons. And what does that do? That drives people to donate to spurious causes, to purchase questionable merchandise, and then go deeper into the rabbit holes in some of these places that just have ungrounded conspiracy theories.
Will mask wearing be a part of our social norm going forward? When I was in Japan, I was there for about 2 years in the Air Force, and it was not a big deal.
It wasn't
to have people especially when you got on the subway to and from work. I mean, everybody wore a mask when they got on the subway. It didn't necessarily was a flu outbreak. I thought it was rather weird, strange, because I'd never really encountered that. But everybody wore a mask and they did what they were supposed to do. The cab drivers had gloves on. When you get in and out of the cab, they had a glove. The doors opened automatically, so you never had to touch anything.
I know. So I visited Japan. I visited Japan on the Marunouchi line. Yes.
Amen. Wrote it.
You have men, women, and children wearing their little masks during the cold and flu season, and it was no big deal. In fact, when I was there, I purchased some of those masks back in the 80s, because I thought they were cute. I said, "Oh my goodness, that is so great." They keep their cold and flu to themselves. They keep. Yes. I'm hoping it'll be part of our public health landscape going forward, but I don't know because of the political issues that have cropped up around masks. And masks, and in fact, not wearing masks has become such a badge of courage among some segments that, I don't think you're ever going to get some people to wear masks. And they are obviously saying they don't care about other people.
That's the key message right there, is that, and I've had the chance to travel all around Florida over the past few years, from the Key West all the way up to the Panhandle. And it has become and is a badge of courage. I'm not going to wear masks. Are you saying that you could catch something from me? No, I'm saying that you could catch something from me. But again, the same inverse message. What you're also telling me is that you don't care if I catch something, because it's just my hard luck. Now that the spring and summer is here, and I can be out more, I must admit I wear masks a lot less. But if I'm going into their enclosed environment, there are a couple of restaurants, I'm still wearing my mask when I go in there.
Absolutely. We do too. We do too. My daughter and I wear our masks. If we ever have to, be around people and stuff, we just do that out of respect for ourselves and others. I mean, we've both been vaccinated. We don't have COVID. We've been tested. My daughter's been tested multiple times because she's a medical student and she has to be. But we do it because it's the right thing to do. In fact, to Japan, it was just routine. It was not a big deal. The people just put their little masks on, and it was not an issue. And that kind of goes back to what I said in the beginning about Americans not thinking of themselves as one people willing to help each other. And I think that is one of the big hindrances to preparedness, any kind of preparedness. And I don't know this for a fact, but I suspect that the next pandemic or issue is going to be bigger than COVID. And so I think we need sort of an attitude adjustment in the whole country. Many Americans are angry. You go to the store, you go places, and people are just angry. So I take it upon myself to just be as pleasant as possible whenever I have to go out, and just be kind to people and gentle with people and be patient. And don't get upset if somebody accidentally bumps you with a grocery cart. Just be kind. We need more kindness, but so many people are living on the edge, and I understand that, because back to some of the structural issues, there are a lot of people who are just barely making it. Just barely. They don't have enough sort of wherewithal to make their lives more pleasant. They may have jobs that pay minimum wage or a sub minimum wage, and they're struggling. They don't have health care. They don't have insurance. And so they're having to work 2 and 3 jobs just to put food on the table for their kids. And so until we get to grips with all of these structural issues, and systemic flaws within this country, then we're going to continue to have social discord, shall we say.
Well, I mean,
Mhm.
it's part of the price that we pay for being such a diverse country and the diverse state here in Florida, and the same in Georgia and Alabama. It is a diverse thing. We're not a homogeneous country as they are in Japan and to an extent even in Russia or Poland. We're not one people as they are there. We are many people, and with different attitudes and cultures and religious things that we bring to the table. And while that is our strength as Americans, it also tends to be our weakness. Look, chronic disease.
Okay.
Is this going to be is it a chronic disease like the flu and other things, or is it just a disease that we're going to have to fight? Chronic disease.
Well, you're talking about COVID as a chronic disease?
Yeah, COVID. Are we classifying this as a chronic disease?
No. COVID is an infectious disease. No, but I do want to talk a little bit about chronic diseases, because that was one of the topics I sent you. Chronic disease is a medical condition that lasts for a year or more, and requires medical attention. Now, a lot is not known about the lasting effects of COVID. So while COVID is an infectious disease, there may be some chronic diseases attached to it as it affects the body. Because I've read a number of studies that show that some people have long-lasting issues after they recover from COVID, but it has not been classified as itself a chronic disease, but some of its lasting effects may be indeed chronic. But I did want to touch on chronic diseases because Black and brown minority individuals are disproportionately affected by chronic diseases. Chronic diseases include heart disease, cancer, hypertension, kidney disease, et cetera, diabetes, obesity, et cetera. 6 in 10 Americans have at least one chronic disease, and 4 in 10 have more than one. So that's an issue that sort of plagues our minorities, Black and brown people. But that is something that we can do something about. I did want to talk a tiny bit about that. Even though the US ranks poorly in quality of life measures like housing, healthcare, and benefits for employees, there are some things that we can do ourselves to sort of mitigate chronic disease and lessen the incidence of chronic disease among ourselves. And that is one thing you can do is eat more fruits and vegetables daily. And one thing I do, cook instead of eat in restaurants. You don't know what.
What?
Cook. Get back to cooking. Hone up your culinary skills. Cook fruits and vegetables and beans and lentils and whatnot to improve your diet. And then probably the single thing that you can do is drink more water. Don't let your kids drink soft drinks. Carbonated soft drinks are not good for anybody. And I know some people love them. I don't love them. I don't purchase them. And so we don't drink them at home. We do keep ginger ale for stomach aches, but we use it for medicinal purposes, not for just consuming. So that's something that you can do. And then another thing I want to advocate for right now is for you to have a better relationship with your doctor. Please, when you go to your doctor, become a human being to your doctor. Don't just be some anonymous person that's sitting there, letting the doctor do all the talking. I always tell people, as I mentor them, because I am a mentor on my job, when you go to see your physician, look him or her in the eye, become a human being with that person, and let them know everything that's ever happened to you, because they need to have a full chronology of every disease, every ailment, every surgery, every issue, because only you know your body. The doctor can't read your mind. The doctor cannot know everything that's ever happened to you. So you have to be the expert on your own health. Go in there and take control of that doctor's visit
I've
and
al-
tell. Mhm.
I've always adopted the policy with doctors and lawyers, but particularly with doctors over years, because I'm
Mhm.
at, especially now, and I remind people, doctors have a what? A practice.
Mhm.
They practice and give you things that should work, may
Mhm.
work, ought to
Mhm.
work, but if they don't get the proper information
That's
from
right.
you, the patient,
That's
then
right.
they're experimenting until it gets right, and that's
Right.
the thing.
That's it. If not A, then B. If not B, then C. And so you have to arm that doctor with all that information and then advocate for your own health. You know your own body. And if you're really ill, please take someone with you to the appointment. Let the healthcare professionals know that you have someone who cares about you. And this is extremely important for you grandparents and parents out there that have daughters that may be expecting a baby. Black women are disproportionately at risk for having negative outcomes associated with pregnancy. So go with your pregnant daughter and make sure that they know everything that they need to know about her condition and her complaints. Listen to her complaints very carefully. If she has chest pains or her legs are swelling or other issues like that, make sure that she is heard, and not ignored, and that's while she's pregnant and then immediately after she has the baby. Just a little anecdote here. When I had Lois, this was 27 years ago. She was premature and they did an emergency C-section on me. And luckily, I bonded with my doctors and my anesthesiologist, because after that C-section, I had a pulmonary embolism.
Mm.
And that is one of the things that can kill you quicker than anything else after an operation. And luckily, my anesthesiologist, who I had bonded with, I love this man. Dr. Golden was his name. He reminded me of Stephen Horowitz, our high school math teacher. And I told him that when I was laying there about to be put out. I said, "Oh, you remind me." So I bonded with him. And because I became human with him, this man would not leave me. He's usually an anesthesiologist will just do what they have to do, wake you up, and then leave. No, this Dr. Golden would not leave me. He held my hand, and the scrub nurse held my hand, and they said, "This lady can't breathe." And so the next thing you know, I was being wheeled into the C scan, and they found blood clots in both lungs. They put me on an immediate heparin drip and round the clock breathing treatment system, and they saved my life.
Mm.
And so I know that Black women have different complications when it comes to pregnancy and after pregnancy. And so I know that you need to be real with your doctor and become human with that person, so they can't just do what they need to do and then leave you, and make sure that your complaints are heard. The same thing happened to Serena Williams. They heard her finally and saved her life. She had blood clots as well. So be human to your doctor, become a human being, not just a thing or something, not just anonymous. And then get in there and advocate for your own health, and take somebody with you if you can't, or go with somebody in your family if bond together to have better health outcomes.
One of the things that has intrigued me about your career over the last few years is that you are a published author. You've co-written a number of health studies that are well documented. One of your first books, along the lines of what you're talking about right now, Behind the Eight Ball,
Yeah.
Sex for Crack Cocaine Exchange and Poor Black Women.
Mhm.
It tends to be a continuing theme for you. I'd like to talk about at least 2 or 3 of the books you have out, but Behind the Eight Ball, why'd you write that?
Okay, well, I thank you for asking that question. It's the first book that I published. It's not the first publication, but I, as a PhD student and PhD candidate, I got a chance to be involved in a large research project for the Department of Anthropology at Georgia State University that interviewed female drug users. And I had never been around female drug users. I didn't know what, I knew very little. Let's put it that way, very little. And so I got a chance in the conduct of that research project. I got a chance to interview Black, white, and Hispanic female users of heroin, cocaine, crack cocaine, marijuana, and all drug use patterns. In fact, the title of that project was The Epidemiology of Female Drug Use Patterns. And it was an eye-opening experience. I was hired as research coordinator on that. And I noticed as I was interviewing those women, the poor Black female crack users had sort of the worst issues, related to their lives. And I became interested in them. In fact, as I moved along in my PhD program, I said, it just became a championing issue. I said, I've got to do something to help these women. And so when it came time for me to select my dissertation topic, even though as I moved along in the PhD program, I became really interested I started broadly. I was interested in inner city problems, inner city Black women's problems, inner city Black women's health problems. And then finally, I kind of honed in on poor Black women who use crack cocaine. And so, being, I guess, courageous or bold, I called the National Institutes of Health. And I just called them. I got their phone number off the website, and I called them and I said, well, do you have any dissertation grants for available for me to apply for? And they said, sure. And they sent me a package. And I took 6 months and worked on a proposal, learning what I had learned from that previous job that I had as research coordinator. And I crafted a really wonderful proposal. And I'm saying it's wonderful because they funded me in 6 months. I didn't have to do a rewrite to the proposal at all. I had my sound methodology. I had an evaluation component. I had community partners to support me. I had outreach workers to support me. I had various treatment centers that gave me letters of support. So, I put together a solid proposal. And so they funded me. And so they gave me a little pot of money to go to treatment centers in the Atlanta area, homeless shelters, storefront outreach, community centers to interview poor Black female crack users. And I had put together a comprehensive interview instrument with questions about their lives, how they started using drugs, their family situation. And basically, I was looking for 3 outcomes because my exhaustive review of the literature led me to these 3 outcomes that I was looking for. I wanted to know if any of them had had sexually transmitted diseases. I wanted to know if any of them had contracted HIV. And the third one, which is the big focus of the work, is I wanted to know if any of them had become pregnant by exchanging sex for crack cocaine. Because the interviews that I had done on the other project led me to understand that many of the women got involved with crack cocaine through parties or social events and this, that, and the other, and they didn't realize how addictive it would become. And eventually they would sell things, sell things in their houses, televisions and boom boxes and whatnot, into a particular drug dealer. And then they would get to the point where they exhausted everything that they have in the house. And then they go to the drug dealer and they would say, well, I've sold everything in my house to you. I need a fix. I need a hit, as they say. And the drug dealer would say, well, if you do this, I'll give you that. And so that's the way it started for a lot of women. They didn't start out wanting to be prostitutes, even though I ran into some women who were, bless their hearts, they ended up on the street, homeless, and they got involved in prostitution that way. But the vast majority of the women did not start out exchanging sex for crack. They they did it out of desperation when their drug habit got so all consuming, and they had, sold everything in the house. And so there was nothing left but their bodies to sell.
Now,
So
sadly, is this still the state of the state of play today?
well, not exactly. I think a lot of the younger people who are still in those areas that where drugs proliferate, they see what their parents went through. So I think many of them have sort of moved away from crack cocaine. However, I did do a follow-up study in, I think it was 2000, maybe 11 or something, like 11 or 12. And crack cocaine has sort of crystallized around a cohort of older users who are still using it, but it's not as prevalent as it used to be. But but the damage has been done. Families were destroyed. Many kids were born exposed to crack cocaine in utero. And crack cocaine is not equivalent to powder cocaine. There is a substance in crack cocaine called methylagonidine. It is a substance that has the potential to form covalent bonds. Those are irreparable bonds with cells in the body, potentially brain cells, and which makes crack cocaine really addictive and really hard to sort of get recover from. And so people don't realize that when they use that you have the potential to be a very long time drug user. And then there are lots of other things that happen. It affects the heart and the lungs, and wasting. It's a terrible, terrible, terrible drug. And it's done so much to damage poor Black communities. And then the other side of that is the so-called dope boys that prey on their own communities by selling it, and they're doing it because they want to, they want money. And, this is America. Everything is profit driven. So that particular issue really became a championing issue for me in public health. Several of my publications are about those women and their issues. And just to go back to the statistics I was looking for, it's a small but rich study. 50% of the women had been exposed to HIV. All of the women had sexually 25% of the women had been exposed to HIV. All of the women had various sexually transmitted diseases, including syphilis, gonorrhea, vaginal warts, chlamydia, et cetera. And half of the women had become pregnant by exchanging sex for crack cocaine. And the vast majority of those women had babies by people they didn't know, or had babies by a drug dealer, had babies by people that they hated. So this was a...
It was clearly a defining issue, book for you and study. Given
yeah, I know it definitely changed my life. For one thing, I didn't realize people were living like this, and that's why it became a championing issue. I just had to do something. I wanted to do something to help these women, and it's amazing that even my dogged efforts, let's say the top-down public health people still didn't think this was a big enough public health problem. And now you spring forward and contrast that with the response to the opioid epidemic.
Yes.
You're seeing all kinds of
lawsuits being filed. All of this for a drug that is legal and legally obtainable by persons, who, of course, who have good medical insurance and all of that.
Right.
And they're suing because they made the wrong mistake, because they made a mistake in asking the doctor to prescribe it for them. It is it's one of those things about America.
Yeah, it's affecting a different population. And so even though I doggedly pursued help for not only women, but men and the whole scenario, the whole families that got affected by crack cocaine, the groundswell of the response was just not there. I tried my best. And I'm looking at all the millions of dollars that are poured now into helping people recover from opioid addiction. And I wanted that kind of a response for the crack cocaine epidemic, but it just didn't happen. I mean, they didn't see it as a big enough public health problem. But if you go into inner cities, you're still seeing the troubled families, the poverty, and crack cocaine just decimated, so many families. It's just such a sad situation. So the book was based on my dissertation. So after I graduated and got my PhD in May of 2000, I worked on the book for about 5 years, and then I, sent it off, and it was published. And every now and then I'll still see a college course that picks it up, and it's gotten a number of citations for being sort of the definitive work about the lives of women who use crack cocaine, because I don't really focus on the drug itself. I focus on what led them to the drug. Many of these women had been in foster care. They were throwaway women, people who nobody cared about, women who will run away from foster care and get picked up by a pimp on the street, or women whose parents were incarcerated, or women who were raped or as children. And I just looked at these beautiful women when I interviewed them, and I saw so much lost human potential.
Indeed.
And I would come home and literally cry and take a ritual shower, because some of their stories were so moving. And I just thought, oh my God, look at this person could have been a judge. This person could have been, because they're really intelligent women, and just their survival skills that were really incredible. And I hope I encouraged a lot of them. I would tell them sort of after the interview, you can do better than this. You can go back to school, and because many had dropped out of school around 10th or 11th grade. And I said, you're smart. You can go, you can get your GED. You can do something else. You don't have to settle for this, and mostly, and I just extended Christian love. You're a wonderful person. I would find something, because I'm pretty discerning, and I've got strong emotional intelligence. I would see something in that person during that interview and focus on that. You have whatever this is, and you have a wonderful personality. You have a gift of this, and you need to pursue that. And man, they walk out of there feeling like, woo, wonderful.
Meeting
mm-hmm.
people where they are is just important, and mentoring them where they are, and then are able to commiserate to the extent that we can with the situations that they're in. Dr. Tanya Telfair LeBlanc, senior health scientist, epidemiologist. It sounds like you're also, well, you are. It says you're a scientist, so you have to be all of that. You are obviously an author here. We didn't get a chance to touch on that children's book that I read. I thought that was quite nice. That you're obviously a skilled author. I'm looking forward to having you back. You are associate editor of the American Journal of Public Health, and a number of other titles. I just know you as Tanya. And,
there you go.
And I'm just pleased that you've been able to make this contribution. I'm looking forward to us continuing the conversation to delve a little bit more in your writings about what's taken place and your thoughts behind each one of them.
Well, thank you. I'm still a little girl from Susie Talbert. I haven't changed much, not really. I'm still that little person. So maybe not so little, but not physically little. But
neither one of us are that little.
Yeah.
So
we're thank you for having me. But I'm glad you mentioned my children's book, because my children's books are geared to preventing negative life outcomes, and they emphasize personal critical thinking skills to help kids navigate this crazy thing called life, and then do something about it to get a positive life trajectory.
All right. Dr. Tanya Telfair LeBlanc, author, scientist. We appreciate you joining us today on To My Way of Thinking. I'm looking forward to having you back so we can delve a little bit more into the book side, your author side of the story. And but thanks again for joining us.
Well, thank you for having me.
Next up, Fred's movie reviews. A look at today's movies. Nightmare Alley, a long, drawn-out character study, released in 2021 on HBO Max.
I'll ask you simple questions. You will answer in short sentences only what you believe to be absolute truth.
Absolute truth. I can do that.
Now, brief as you can. What is your name?
Stanton Carlisle.
Are you a true medium?
Yes, I am.
Mr. Carlisle.
Doctor, how about that?
Please lie down. Can you read minds?
Yes, I can. Under the right circumstances.
Keep the answers brief. What do I want?
To be found out, same as everybody else.
Are you in contact with the beyond?
Well, we've had our share of snake charmers in the past. We deal with them.
This Guillermo del Toro study in the life of a carnival character could have been done in less than the 2 and 3 hours it took to bring us to the character's sad end. It's a bit of a kill-em-all that takes the character and the audience through a carnival row on a tour of life in 1940s America. Co-written by Kim Morgan, this always raining, always snowing look at middle American life with no Black, Asian, or Hispanic people is interesting, but not very captivating. Bradley Cooper shares the producing credits with good photographic direction by Dan Lautsen. It's a great time waster, but not a very endearing storyline. I won't watch it again. Nightmare Alley, released in 2022 on HBO Max. 7 of 10 stars. That's going to be it for this edition of Fred's Reviews and To My Way of Thinking. See you again next time.